name's Karishma.
Hi.
I'm a pharmacist. I just want to discuss this medication here with you.
Sure.
Okay, so that's just the canister. Is it for yourself?
Yes, it is.
Okay, do you know what the doctor's prescribed
Well,
for you?
I've been on a long course of antibiotics, and then I've got a vaginal thrush at the moment, so that's what the doctor gave me.
Yep, that's what happens usually when people are on antibiotics for a long time. You're more likely to get the thrush. So with this medication, what he's actually given you is a once pessary and a cream. With the pessary, it's basically like a tablet, but it's not for oral use. It's supposed to be inserted into the vagina. Have you ever used a pessary before?
No, I've never used one before. I've never used this before.
Okay, so I'm going to show you how to use the pessary. Would you like me to open the box and show you what it's like? Okay, so before any of this, you need to make sure that you wash your hands before you touch anything in there. And also, the doctor has said you can use the pessary immediately, and then you can use the cream 2 to 3 times a day. But if you're going to be walking around the whole day, and you're going to be doing a lot of activities, it's best for you to use it at night. You can start with the cream for now, just to give you some symptomatic relief, and then you can put the pessary on at night. Okay, so I'll just show you what that's like. It comes with an applicator, so I'll show you the applicator. This is what the applicator is like, and the pessary is in there. I don't want to touch it now because I haven't washed my hands. So make sure you wash your hands, lie on your bed, and put your knees up before you insert this into the vagina. Press the tip of this so it's in that shape, because that's the shape of the pessary. Put it onto that, let loose, and then slowly insert that high up into the vagina, as high as you can go, not too deep if it's not comfortable for you. And then just release it there, and then slowly pull that out. You can wash it and keep it, or you can just throw it away because there's nothing else you're going to be using this one for. And then with that one, what happens is it's just sitting there, and it'll help get rid of the infection. And if you're doing it at night or whenever you are doing it, there will be a residue that comes out the next morning. And if you're going to do it during the day, then you can use a panty liner because you don't want to make everything messy. That's it. And then the cream that comes in there, you can use it 2 to 3 times a day, so that's just for the outside. With this medication, you will realize that maybe you put the pessary for 1 day and you still have an itch. That's because the infection will go away, but the itch still stays for a few days. So that doesn't mean it's not worked. It has worked. It just takes a few days before it's all going to get
So just keep using the cream?
Yeah, you can use the cream 2 to 3 times a day, just so that there's no itchiness on the outside. Obviously, if you get a local reaction to this, then stop putting the cream and just straight away let your doctor know that you've got a reaction to it. Was there anything else you want to ask me about this medication here?
This is the first time I've actually got thrush before. How did I get it, and how do I prevent it?
Okay, so basically, like you said, you've taken antibiotics. So what usually happens is antibiotics don't only get rid of your bad bacteria, they get rid of your normal flora as well, and that disturbs your bacteria that are in your body, and that's why you get the thrush. You can also get it if you're diabetic, or some people say soaps and detergents can also cause you to get thrush easily. Some people, like if you're wearing synthetic underwears and stuff, then you're more, because it's all moist and that's an environment for fungus to grow, so you can get it like that. So what you want to do is you want to make sure you're not wearing any synthetic underwears and everything, and like don't use any detergents or anything in the area. Just try to water is good enough to wash, and yeah, just with that one. And you also want to make sure, like, just to keep your normal flora just at the normal levels, to prevent like getting thrush very occasionally. You can take the Inner Health Plus. That's just to restore the normal bacteria. So have you ever taken the Inner Health Plus?
I had started once. It's actually a little bottle kept in the fridge.
Yeah, the one, that's the one. So you can just take one of that every single day, and that's it that you need to know about that. Was there anything else?
No, that's all. Thank you very much.
I'll give you your CMI. If there's anything that you would like to read on there, and your medication. If there's any questions, feel free to call us at the pharmacy.
Okay, thank you very much.